Sex is not supposed to be painful. However, for several women, not only is sex not pleasurable, but it is very painful. It shouldn't be so. If sex is painful, there is a problem somewhere. And there are several causes of painful sex, from virginity to endometriosis to fibroids to injury, maybe during childbirth, to vaginal surgeries, to female circumcision or female genital mutilation, to inadequate lubrication, to vaginal infection, to vaginismus, and so on. And as usual, the general solution here is to find the cause of the painful sex and fix it. But today we will be looking at the 3 most common causes of painful sex and the solutions for them. Okay, the first common cause here is insufficient lubrication. Now, the vagina lubricates itself, especially if the woman is well aroused. The vagina gets wet and makes sex less painful or not painful at all. However, if the woman is not in the mood for sex or doesn't want sex, or if the foreplay is not adequate, the woman doesn't get lubricated well enough, she doesn't get wet enough, and because of that, sex may be painful. And similarly, in menopause, when a woman stops menstruating, and some other similar medical conditions where there typically is vaginal dryness, the woman may experience pain during sexual intercourse. Now, the solution here is prolonged and adequate foreplay. The men should learn not to just penetrate. Take your time to allow for natural, adequate lubrication before penetration. In addition, if you are one of those women that no matter how aroused they are, they don't get lubricated well enough naturally, there are different types of lubricants out there that you could get from the pharmacy and rub both on the entire penis shaft and in the vagina before penetration to help with lubrication and reduce pain during sexual intercourse. The second very common cause of painful sexual intercourse is infections. Now, there are some infections that cause vaginal dryness and also cause vaginal pain and pain during sexual intercourse. Some of the infections include infections like yeast or fungal infections, also infections of the cervix, that's the mouth of the womb, typically causes pain on deep penetration, and the woman feels pain deep inside, especially during deep sexual penetration. Also, again, pelvic inflammatory disease, PID, causes such characteristic deep pain on deep penetration. And there are sexually transmitted infection, STDs or STIs, like herpes, genital warts, and so on, that could cause painful sex, and especially STDs that cause wounds or sores. They could cause painful sexual intercourse. And the solution here is quite simple. Meet your doctor to treat that infection that is causing the painful sex. And if the infection is treated, most likely the painful sexual intercourse will be resolved. The third very common cause of painful sex is vaginismus. Now, vaginismus is more of a psychological problem. Vaginismus is an involuntary contraction of the vaginal wall due to the woman's emotional state or due to the state of her mind or her unconscious mindset about sex. Now, due to her mindset, the vagina chooses on its own to contract. So it's quite strange and dramatic. The woman might want to have sex, but because of her mindset and emotional state, the vagina seems not to cooperate and rather contracts. The emotional states like anxiety or when she's not fully relaxed, guilt, fear could make the vagina to contract, most times against the woman's will and against her control. Therefore, if you have a faulty view of sex, say you see sex as dirty, as sinful, or as a negative thing, or something not to be desired, or something that is meant for men alone, just that mindset could make the vagina choose to close up in order to prevent penetration, or have what is called fear of the penis. And if penetration is attempted, there will be pain. Also, if there is a past history of sexual abuse or forced sex or rape or date rape, the emotional trauma could cause vaginismus and can cause vaginal contraction during attempted penetration. Now, the solution here is quite complex. You may have to work on your mind and work on your mindset about sex to make sure you see sex as something that is pleasurable, desirable, positive, clean, and something also meant to be enjoyed by you as a lady, something to be desired, and so on. You may need psychotherapy for vaginismus, and you should see either a medical doctor, a sex therapist, or a psychologist, or any psychotherapist that can help you with the renewing of your mind and changing of your paradigm and viewpoint concerning sexual intercourse. Did you find this video very helpful? Don't forget to hit the like button and stay subscribed, and check the description section for a free ebook titled Fire Your Doctor. Take charge of your health and happiness.